talking with Dr. Kennedy about careers in home care like CNA, LPN, RN, physical therapy, occupational therapy, and speech therapy. We talk about schooling, pay, how to get started, and why home care is one of the best places to work. Let's get started.
How are you doing?
I'm good. How are you?
I'm doing good.
Good to see you.
Good to see you too.
Dr. Kennedy, can you share an example of how working in home care helps you build a close and more personal relationship with a client?
Yes. So my path into home care, maybe I can give people an idea of how I got started in home care. Growing up, I had a great grandmother. Her name was Jaja Meme, and Jaja Meme really inspired me into going into home care. She lived, well, back then, in our times, or by their times, they didn't really have birth certificates in Uganda. Yeah. So there's a debate in the family of how long she lived. Some people say 98, some people say she might have been 105.
Oh, wow.
But during her final years, I built a great relationship with her, a strong bond with her. She couldn't walk. And in the village we were staying, there was no wheelchairs, no walkers. So she could just only crawl on the floor. So all she did was, crawl out of her bed, come to the porch, watch the great grandkids play outside, and crawl back inside the house. And every time she would be sitting watching us play or watching what was going on, I was the person she always called upon to bring her food, go get her something. So I was her legs. So I kind of draw my starting point or my calling to that experience, because even when I went through school, because when I got here, I asked my mom the question, what is the highest paying job in America? So and my mom said, oh, pharmacy, being a pharmacist pays a lot of money. So I set my path to pursuing pharmacy. Then I realized that I wasn't good in chemistry. Chemistry was too hard for me. So we had to make changes. So I, focused on what I was good at. I was like, okay, I'm playing sports. I wanted to be a soccer player, but I was getting injured a lot. And as I was getting injured, I would get physical therapy. So I was always finding myself in the physical therapy clinic. So that's how I got introduced to physical therapy. And at first I was like, okay, if being a professional soccer player doesn't work, I'll become a physical therapist for Manchester United.
Why not a referee?
I was a referee at some point. But I wanted to be a physical therapist for Manchester United. But as I went through school and as I did internships, because when you go through school and you do the internships, they expose you to the different settings.
Yeah.
And I worked in a nursing home, I worked in an inpatient facility, outpatient clinic, and then my last setting was the home care setting. And that's how I was like, wow, this is it, because I really loved what the home care setting really focused on. And it kind of drew me back to that experience I had with Jaja Meme, being able to take care of her as a little boy. And I was like, wow, this is it. That's when I realized that this is what I wanted to pursue. And the experience has been great. You meet people who are in need, they have pain, and then you build personal connections with them, personal relationships with them, and then they become part of your family and you become part of their family. So there's nothing that can really beat that one.
That's interesting to hear. How has home care given you more flexibility and helped your work-life balance?
So I'm the type of person who can't really be in the same place. I'm a multitasker, so I like to be on the move. I like to be on the go. So when I'm in an office or a setting where I'm not on the move, I feel like I'm in prison. So home care allows me to to be able to have that flexibility to go from place to place, be independent, set my own hours, and be able to achieve more because I'm working smarter and also getting paid well in the process.
Do home care jobs pay well? How does home care compare to home hospitals or nursing homes?
So home care pays really well. Actually, in terms of settings that one can work in, you have the hospital, and then you have the rehab setting. Like let's say if someone was getting hip surgery, they will go to the hospital, and then the hospital will do the hip surgery. But before the hospital sends them home, they'll probably send them to a rehab, what's called an inpatient rehabilitation facility. So that rehab, they will stay there short term. So it will be like maybe like a 3 to sometimes 3 months, 3 weeks to sometimes 3 months stay in the rehab setting. And then the rehab setting will send them home. So in those settings, a lot of people want to do the hospital work. Some people really want to do the rehab work because it's a stable setting. Everything is predictable. Home care is more on the other hand where there's not a lot of control. Every day is a new experience, so you can't really control the setting because it's a home care setting. But in all those settings, the home care tends to pay more because it's one-on-one. So it's the uniqueness of one-on-one experience, the convenience that the professional is going to the patient's home. So instead of the patient coming to the professional, so those are kind of the difference. So you find that in a home care setting, the pay is a lot higher compared to the other settings.
For someone new to the country, can you explain the basic schooling needed to become a CNA, LPN, RN, PT, OT, or speech therapy?
Yes. So, because I get this question a lot, and this is why I really wanted us to have this conversation, because a lot of people call me, a lot of parents call me asking me to kind of give advice about what type of career path or in the healthcare setting that they should take. So to kind of draw a picture, there's beginner level and then there's advanced level. So beginner level, we have the caregivers. Most people who come here from a different country, majority, they always end up in the caregiver role. And in the caregiver role, it's kind of broken down to being a home health aide. You can be a home health aide, you can be a personal care assistant, you can be, there's even things like adult foster programs where you're taking care of your parent and getting paid for it. Then, so those are kind of the breakdown of the beginner role. The pay is a little bit different, but mostly the same. And the schooling is not that much. So some states require anywhere from 4 to 10 weeks of schooling for someone like a home health aide. And then you move on to the CNA. So the CNA is a certified nursing assistant. So that kind of requires a little bit more schooling. So anywhere from like 100 hours of schooling, and then also taking a certification and getting the CNA certificate. So that one pays a little higher, and it allows you to work in more of a clinical setting, like a nursing home. So you're able to get jobs in the facility because you have that. Then you move on to LPN. LPN is a licensed practitioner nurse. So LPN requires like 1 year of schooling. Of course, you're gonna have to pay a little more money for the schooling, but you're also gonna get paid a little bit higher compared to HHA. So just for comparison, HHA pay is anywhere from like $15 to $22 per hour. LPN is anywhere from like $20 to $25 per hour. Then you move on to RN, and RN schooling is anywhere from like 2 years of schooling to 4 years of schooling, depending on if you're doing an associate's degree versus a bachelor's degree, which is 4 years. So that requires more money for school, but also you're gonna get paid a little bit higher. My recommendation for someone who knows what they really want to do, pursuing RN is a great thing, because then you're really not having to go through all these tests. But if you just want to try it out, then it's always good to get your feet wet and start with those type of settings. Then you move on from RN to physical therapy, which is more of a doctorate or master's degree. So physical therapy, you're gonna do your 4 years of college, then you're gonna add on an additional 3 to 4 years, depending on which school you go to. And that one, the cost is a lot more, in hundreds of thousands, mortgage type of debt. But you're also gonna get paid a little bit higher. So you're looking at, in a home care setting, physical therapist gets paid anywhere from $60 per visit to $100 to sometimes $150 per visit, depending on the location and setting. So definitely, hopefully that outlines. Of course, in the rehab portion, which is as the physical therapist, occupational therapist, speech therapist. So those are the master's degrees, doctorate degrees, but you see the progression. One thing I want to highlight for people who are interested in doing a home care agents, like I did, having a RN degree allows you to be able to get those licenses to start your home care agency. So you need a physical therapist, but you also need an RN. So those two, if you get someone to become an RN, you become a physical therapist, you guys come together, you can be able to even create a great opportunity.
From what I've heard from you and the experience you have, what advice would you give someone new to the country who wants a career in home care? Are there grants or help available?
Yes. So when we first came, like me and my siblings first came here to this country in 2005, my mom had a friend, and that friend gave us a lot of great advice. So she kind of mentored us when we came here about this great nation. And one of the things she said that stuck out to me was, America is the land of opportunities, but you need to know who to ask or where to look. Those two things stuck out to me. You need to know who to ask and where to look. So there's a lot of great opportunities for people who come here, and there's a lot of help. There's free programs for immigrants who come here. A lot of schools have designed specialized programs for immigrants. A lot of student aid it can be found in the schools. A lot of grants are out there, and there's also NGOs, like non-profit organizations, who focus on helping people who come here to have support to get the education that they need.
Some people think home care is not a real job. What do people get wrong about home care?
So this is more of a conditioning thing, because when we look at jobs, we are trained or conditioned to think that I need to do a 9 to 5. So majority of people are conditioned that, hey, you need to clock in at 9 and you need to clock out at 5. The home care setting is not like that. In the home care setting, you are considered a professional. You have the autonomy, meaning you have the independence to dictate your times. If I want to go out and start a visit for a client who maybe has a busy schedule for the day, and me and the client agree to do the visit at 6 a.m., I can do that. If the client wants me to go see them at 8 p.m. and my schedule offers that or can work out with their schedule, we're able to do that. So we have that flexibility to be able to do that you are able to. So for example, if I have my doctor's appointment, I don't need to call out all day. I can schedule my clients around that appointment, be able to do the appointment and go still see my patients and still be able to get paid. So for me, I feel like that's a smarter way of working. And also you have the independence and the flexibility. But one thing I really love about the home care setting is that it's one-on-one. And that one-on-one experience that you bring, and you're able to connect with these patients, because they're going to tell you their stories. They're going to tell you their fears. They're going to tell you their challenges. They're going to tell you sometimes even their deepest secrets that they don't tell anybody, or even that they're not willing to tell their children. So you get to get all of that, and for me, I feel like it's a blessing. And in a way, it's a lot of wisdom, because when in this setting, in a home care setting, you're working with mostly our older adults, and those older adults, those are the golden years, and golden years, that means wisdom. Wisdom. That's a lot of wisdom, so they get to pass to you, and you're like kind of soaking it in. So maybe that's why I'm a little wiser. Who knows?
Some people start as HHAs or CNAs and then grow into bigger careers. How does home care help someone grow step by step?
Yes. So the thing what I love about home care, because in life there's principles, and for me I always go by the principles, because the principles don't die and they outlast time. So that's what I love, principles. So there's this principle of being in a box, and sometimes life puts us in a box. And me, I hate being in a box. That's why I prefer the home care setting, because it's so open. It's wide open. You take it how you want to take it, right? So if you want to, let's say if you start out as a home health aide, which is the entry level, you start out as a home health aide or a caregiver, then you can be able to move on to all the other phases that we talked about. Move on to a CNA, move on to an LPN, move on to an RN, or move on to a doctorate level like I'm on. So you have those growth paths to be able to do that. But also the other opportunity, for example, I'll give an example of my business, caregiver rehab services. So before I started caregiver rehab services, I thought about what business can I do that is not confined to geographical location. Meaning, it's not restricted to just one zip code. That this is, we are in Framingham right now, right? That, because if I did a clinic in Framingham, that clinic is just in Framingham. And everybody can only, the people in Framingham are the only ones who can access that clinic. But if I do a mobile clinic, where now the services are going into all these different communities and cities, now that opens up the opportunity. So that's a bigger opportunity. So there's this small opportunity of being a caregiver, or you can take it as big and stretch it as I did, to where you're able to service more people, provide more help to other people, provide more job opportunities to other people. So I think that's a greater way to think about it.
Oh, that's really cool. I love the flexibility that home care gives you. Is there anything that you want to tell us?
Yes, I think healthcare is a great place to be for anybody who is interested, especially for people who come from other countries to here. The great thing is that healthcare or home care is, or you have job security, and job security is one of the things people worry about. Just a little caveat, healthcare is very unlikely that AI is going to replace your job. For those of you who have fears of AI taking your job, it's a great place. People are always going to need help, and more people are aging, and as people are getting older, more and more people want to get services at home as opposed to other settings, because I even think people who live home live longer than people who live in a hospital or nursing home. So the longevity that it offers the patients and also the job security for someone who's interested that your job is going to be secure. Those are great opportunities. One thing I'm going to give, especially for our people from Africa or Uganda, is that follow your passion. Try to follow your passion. Whatever that passion is what you should really focus on. The great thing about being here is that you can literally pursue your passion. The land gives you the opportunity to be able to pursue your passion as opposed to other places. So whatever that passion is or that calling is what you should really focus on. And because a lot of people ask me, well, how do you know that this is my passion or this is my calling? So how you know that this is your calling is, one, if you're willing to do it without getting paid and you find joy in doing it without getting paid, you will know that that's truly your passion. If it comes easy to you, some things come easy to us, but it's harder for other people. So if it really comes easy to you, that, hey, whenever I help Miss Johnson, I find it so easy. I'm so passionate about it. I feel at home. I'm at ease. That really comes easy to you. That's your passion. So that's how you discover it. So those are the final comments that I wanted to offer or add.
Thank you so much, Dr. Kennedy, for breaking down everything so clearly. If you are watching and thinking about joining home care, this might be the perfect place for you to start. Whether you want to be a CNA, LPN, RN, PT, OT, or speech therapist, home care gives you the chance to grow. Thanks everyone for watching. See you in the next video. Bye.